Welcome to a powerful new series called Real Talk, Real Change. I'm Carlos Watson. Now, I've got a great episode for you, working with my friends at Chevrolet to bring you some of the most interesting thought leaders and cultural voices from all around the globe to talk about what it takes to create lasting change in America. Now, today we're taking on one of the most important issues that we all face. Of course, that's our health. I'm also going to call on you to get involved and to be a part of the change that you want to see in the medical community. Hey, this is going to be a bold conversation with bold consequences on the line. This is Real Talk, Real Change.
You're broken down and tired.
I just want my pain to end, and I maintain if I was white, I wouldn't have to go through that.
Tear me to pieces, skin and bone.
We're now a year into the pandemic, and we all know that blacks are 3 times more likely to get the virus than whites.
We saw this huge disparity in the infection and even the death rates were both blacks and Hispanics.
It should make us mad because people should walk into a hospital feeling safe.
And we'll rise up.
Scientists have raced to get a vaccine in the arms of Americans, but many black and brown people are refusing to take it.
There are a couple of things about it that worry people.
Why do so many black people distrust the medical system? The answer is rooted in horrific abuse that dates back to slavery. There's the infamous Tuskegee experiment, where doctors told black men that they were being treated for, quote, bad blood, but that was a lie. They deliberately allowed syphilis to progress in the men by withholding treatment from them without their knowledge. The experiment went on for 40 years. The case of Henrietta Lacks, a black woman who died of cervical cancer in 1951. Doctors harvested her cells for research without her knowledge or consent. James Marion Sims was a 19th century doctor who was known as the father of modern gynecology. He accomplished his medical breakthroughs by practicing excruciating experimental surgeries on enslaved black women without using anesthesia. And up until just a few years ago, medical books included myths like this one.
Do black people feel pain the same way as white people? A 2016 study showed that 50% of medical students and residents who were studied thought that black people couldn't feel pain.
Medical students were taught that black people have thicker skin or less sensitive nerve endings than whites, so they feel less pain. The pandemic has exposed one of America's dirty little secrets. Turns out it's also a medical emergency that we can no longer ignore.
This is how black people get killed.
Joining us now, Dr. Jen Ashton and Dr. Jen Caudle. Welcome to you both. It's nice to see you.
Thank you
for having me.
Dr. Caudle, you think that we've hit an inflection point where the combination of things that have happened over the last year fundamentally will create different experiences for patients of color, particularly black patients?
The systemic and historical racism that brown and black people have experienced throughout this country over the years in so many different sectors, it literally is sort of widespread. While these are things that I've known about and my community has known about, what I'm really happy to see in this last year more than I've ever seen before is that now the nation is talking about it and talking about it in a way that I hadn't really heard about before. So even though I know there's a lot of work to be done, I'm hopeful that this is the start of a new day, that this sort of reckoning that we're experiencing will translate to, eliminating racial health disparities.
And Dr. Ashton, what about you? I've spoken to so many friends I know who are not black in the last couple of years. Has been a revelation. When you see pieces like that, are you surprised?
I've seen firsthand women of color get different care in obstetrics, in gynecology, and it's a bias that most people in the medical field are unaware of themselves. And all I can say is time's up.
Dr. Ashton, how much conversation are you seeing when you're in predominantly white settings? Are they talking about it differently? And do you see any tangible action that is giving you hope?
We have determined that women of color are at higher risk for a plethora of medical conditions, diseases, complications, and they should be prioritized in terms of screening, testing, treatment, and care. The problem comes in this trend that we shouldn't see color. I disagree with that. I think we should see color and we should prioritize care based on those risk factors. The risk really becomes and exists when the medical system says, no, we're going to treat everyone the same. I think just as we should have with COVID, be doing more, not the same, and certainly not less for women of color.
You know, Dr. Caudle, as wild as that may sound to people right now, what would happen if we created 100 all-black hospitals around the country that were meant to be top tier, best of the best?
Statistically, Black patients and patients of color do better when their doctor is Black or brown like them. In terms of creating environments to basically prevent maybe the racist and the racism and sort of the inequities that happen, to me, the solution is people just need to stop being racist and start looking at people and communities and individuals the way we really are. And to what Dr. Ashton mentioned, this concept of not seeing color, I think that's a very interesting point because we're always judged by our color. And that's exactly the dichotomy that is the problem here. And the fact that...
But Jen, see, I think we're saying the same thing only in different ways. I would argue that it would be malpractice if a physician of any color saw a Black person and didn't recognize in a proactive way that Black patient has certain risk factors that a non-Black patient doesn't have. And
no, you're
so I think, so I think we're saying the same thing,
well,
just
but
different
I am,
ways.
But there is, and I do agree with you there. We're speaking the same language, but what I want to do is take it a step further, which is I worry that there's not enough physicians and healthcare providers that actually think about that when they see a Black patient.
Yeah, I think if people don't see that, they have been,
But I think many people don't. I think many people don't see that. That clip that was just played that said med students think that Black people don't feel pain. This is exactly the type of mentality. That's the problem, and that's why this year has been so critical. Is because I think for many people it's been an awakening.
I think that one of the things that we often forget is how emotional this is. It can be difficult, at least for me, and I assume for a lot of us, to engage in these conversations. And I think that there are a lot of people who come to this not just with a knowledge that it needs to be different, but also a real emotional weight to it.
It makes me so mad, and I'm so sorry. Like, this is not, but it just sort of set up a dynamic where you're almost like re-traumatized over and over again, even though you know what's in it. It infuriates me.
Dr. Ashton, I'm going to give you the last word here.
To dovetail on so much that Jen said, I mean, first step in medicine and public health and science is observation. And we know what the observed issues are. Now we have to address them.
Dr. Ashton, Dr. Caudle, thank you guys both for joining me today. I really appreciate you.
Such a pleasure. Bye, Jen.
Bye, Jen.